Hi, and welcome to Psychology 370, Fall of 2022. We're the Death, Dying, and Grievings group, and we're going to discuss what we can learn from death, dying, and grief. This is a presentation created by Elizabeth Allegria, Melody Owen, Starla Thomas, Patricia Titman, Urvashna Ram, Simran Ram, and Rebecca Scruggs.
Our mission is to find ways to enable conversations that may help with normalizing the grieving, death, and dying processes, along with discussing ways in which to better provide resources for the terminally ill, caregivers, and the other susceptible groups that may be impacted. Throughout this presentation, we will include our personal research to support our topic and to provide a new perspective regarding death, dying, and grieving. In addition, we aim to connect this information to our own career paths and identify ways in which this research will benefit us in our own professional endeavors.
Hi everyone, my name is Elizabeth, and today I'm going to be touching base on the concept of good death. So this is something that we've discussed throughout the semester, and in particular during this unit of death, dying, and grieving. So what is the concept of good death? Essentially, it is a death that is free from avoidable distress and suffering for patients, family, and caregivers alike. Some characteristics of this concept is a death where the patient has full control over the specific dying process, a pain-free status, engagement with religion or spirituality, experiencing emotional overall well-being, having a sense of life completion or legacy, having a choice in treatment preferences, experiencing dignity in the dying process, and most importantly is having family present and saying goodbye during this transition period. And the good death theory does directly tie into my personal research topic of pediatric palliative care, or PPC, and the good death. This study in particular, its objective was to identify healthcare discrepancies regarding pediatric palliative care in comparison to adult palliative care. And the main question is, what is end-of-life care? End-of-life care, palliative care, or hospice care is care that focuses on fully supporting the patient and their families, and coping with the symptoms, discomfort, and stress of the serious illness that is ultimately ending the patient's life. The ultimate goal of palliative care is to relieve the suffering of patients who are terminally ill. In this study in particular, adult and pediatric palliative care settings were compared, and this research found that the concept of good death was more present in affluent, higher resource areas, such as adult palliative care settings, as opposed to developing areas, such as pediatric palliative care settings. PPC settings were also less likely to maintain the same ethical standards, oftentimes being overlooked in the healthcare system. This study also found that families and caregivers of children that were in palliative care also carried a greater burden and oftentimes weren't offered the same quality of resources as families and caregivers in adult palliative care settings. And what I mean by burden is that most times these families that were dealing with their child dying felt more obligated to publicly accept the death, yet they continue to privately grapple with the grief. And as we all may know, that's something that's not very healthy for the healing process in general. So connecting this specific study to my future career aspiration of becoming a nurse is that palliative care is an essential part of healthcare, and although we oftentimes don't like to think about it, death can truly occur at any developmental stage. And as a society, sometimes we don't like to acknowledge this, but opening up this conversation can definitely help identify areas of improvement in our healthcare system and better strategize ways to ensure that all individuals are able to experience a good death if the circumstances allow. This study also definitely offered me a new perspective that the objective should never be to find a way to conceal death or to create a false narrative of what the process actually is, rather to facilitate important conversations and as a medical professional to make lasting, impactful changes And such topics can also maybe even bring about new research topics that could improve methodologies or better healthcare professional trainings regarding palliative care as a whole.
Hello, my name is Starla, and I will be talking about dialectical behavior therapy. Dialectical behavioral therapy is also known as DBT. It is a type of therapy where people who experience borderline personality disorder, as well as other mental health conditions, go to seek professional help. DBT helps people focus on learning how to manage their emotions and helping them form social relationships with others. With suicide being one of the top causes of death and it being tripled amongst teenagers and young adults, these are the resources where people are needed the most and more support within their communities. With DBT, people are able to go somewhere where they will be understood and have many support people within their town and so forth. Although these treatments were mainly created for individuals who have suicidal and self-destructive thoughts, these treatments can also be intended for people who have personality disorders, constant occurrences of psychiatric conditions, and emotion dysregulation. In the future, since I'm planning to become a therapist, I plan to work with adolescents to help them cope with the losses of their friends, peers, and this huge mental burden that they're left with. This connects with my career path also by having resources available through therapy, by helping young people deal with their losses, and having a place where they can cope. With young adolescents constantly facing the stresses of social media and having it harm their mental health, they need somewhere to go where they have an outlet to overcome their troubles. I plan to work with these people to help them cope with the losses of their peers and family.
Hi, everyone. My name is Patricia, and my topic was discussing preterm and neonatal morbidity and mortality as it relates to gestational age. This is important to understand that death can happen at any age, and for my research specifically during pregnancy. The question at hand is, what is preterm morbidity and mortality, and how does it connect to my future career, which is ultrasound? So preterm morbidity is something that occurs at birth, is when birth occurs at less than 37 weeks, so preterm. And then as a result, you're left with serious or lifelong illnesses and disabilities. These disabilities can include learning, visual, or hearing disabilities. And then preterm mortality is death caused by preterm birth. The study shows that through the use of ultrasounds and prenatal care, we can catch any potential or fatal fatal lifelong changing conditions. And the study that I had done my research on was a secondary analysis of an obstetric cohort of 115,502 women throughout 25 hospitals. This was a study ranging between 2011 and 2015. And through the study, they were able to determine that the relationship between gestational age and preterm morbidity and mortality is that as your pregnancy progresses, the risk for these fatal outcomes are decreased. And so through this knowledge, as somebody who potentially will become an ultrasound sonographer, I'm able to use my knowledge to aid and prepare parents for potential hospitalizations or death through routine ultrasounds. And then also offering proper care, and we're able to catch anything, as it arises. Thank you.
Hello guys, my name is Ravashna. I'll be talking about infant death. Sudden unexpected infant death syndrome, also known as SUID, usually happens unexpected death of a baby less than a year old. The causes are suffocation when no air reaches the baby's lungs, usually caused by a block in the airway. Also infection when a baby has a cold or other infection caused by a virus or bacteria that makes breathing difficult. Trauma is also one of them, or it could be accidental or non-accidental when a baby experiences an injury. This connects to my career path in therapy or counseling. through the immense knowledge I will accumulate as I try to learn the different causes of infant-related death, denying, and grief. Furthermore, as a therapist, I will use the knowledge to offer better remedial actions to the bereaved families should there be an infant death. The most commonly reported causes of suffocation in infants is accidental and strangulation in bed. Other causes of infant suffocation include like overlaying or accidental suffocation on a shared sleep surface.
Hey class, my name is Melody, and I'd like to discuss what can be done to help someone who has experienced an unexpected loss. We could share the resource of 5 stages of grief, which are denial, anger, bargaining, depression, and acceptance. The impact of knowing the different stages of grief that one experiences can help with the awareness of feelings and cognitive behavior that a person can be going through. Offering support and direction can influence a person with compassion and empathy. Treatment options should be given if one's symptoms of experience in an unexpected loss takes an unwelcoming turn into a life-threatening situation. I have also brought up that I would like to talk about chronic depression. Chronic depression is sometimes overlooked and is also linked to the chronic health conditions. Many cases of long-term chronic depression leads to suicide in many forms. Patients with chronic depression will purposely deprive themselves of food and hydration with the intent of ending their lives. This is due to knowing that their quality of life has declined. These people suffering from chronic depression have already made up their minds. As healthcare providers, we are against this and do the best to encourage them to care for themselves. In teenage years, persistent depressive disorder, left untreated, managed, and can lead to chronic depression. In the research that I have seen and read, most of the patients that suffer from chronic depression slip into psychosis. Psychosis is defined as a severe mental disorder in which thought and emotions are so impaired that the contact is lost with external reality. Individuals with poor social functioning may be at greater risk due to lack of problem-solving skills, impulsiveness and aggression, poor social skills, and social isolation. Loss of social support, especially from a family or a therapist, is a large risk factor. Not being able to return home after hospitalization also increases the risk. Resources for this comes from the American Psychiatric Association and SAMHA, Substance Abuse and Mental Health Services Administration. I would also like to add the warning signs and symptoms of psychosis. It is the most important that we know the signs to watch for. NAMI, Chief Medical Officer Ken Duckworth guidelines discussions on early psychosis, insights from individuals, family members, and mental health professionals. Early warning signs include a worrisome, suspicious, or uneasiness with others, trouble thinking clearly or concentrating, a decline in self-care or personal hygiene, spending a lot more time alone than usual, having strong inappropriate emotions, or having no feelings at all. In the first episode of psychosis, the signs are different from others. These include hearing, seeing, tasting, or believing things that others don't. Constant emotional help must be given. There are early indicators that something unwelcoming is going on. Chronic depression can set in without correct guidance. It is up to us to make a difference. While working as a CNA, chronic depression has really tied into my career path. As moving forward in my career, I choose in the medical field, the issue comes up. Nobody likes to be sick or have a medical condition. When having a medical condition that can be life-threatening, it is important to know the best approach to discuss and arrange for end-of-life services. I have had lots of interest in working with hospice care, comfort care. As a CNA, I have worked alongside of hospice nurses, and I have been by the side of many adult and elderly patients at the end stage of their life. I have provided care and been supportive to their family members. It is important when working with clients to have little to no quality of life to be encouraging and uplifting while providing care. It is vital to add some sunshine into their life. Mental health does tie in with physical health, and it could lead to serious declining issues. This is why discussing chronic grief and chronic depression is important to me. Up to 30% of patients in nursing home have a form of depression.
How avoidable is death in older age? Today, I'm going to be taking a deeper look into Sigmund Freud's findings about middle adulthood and the avoidability of deaths in hospitals. Freud believes that all humans live to die. He defines it as a quote-unquote death drive. While typically this death drive is directed outward, making us aggressive towards others, it can also be directed inward, creating us to feel suicidal or want to self-harm. He concluded that people had an unconscious desire to die, but life instincts largely overcame that desire. After taking a look at that, I will be discussing more about the avoidable deaths that occur in hospitals and how to prevent these deaths from happening. Per the random samples of 396 patients in hospitals, over 30% of their deaths were deemed avoidable by more than 50%. Every middle-aged person I know has felt overwhelmed and come to a breaking point. Whether it is school, work, kids, or bills, something always comes up, and sometimes it feels like they can never catch a break. Knowing that my mom raised 5 girls on her own essentially and has not had an off day in 30 years, I am constantly amazed and impressed at her strength and grit. She explains to me now that I'm older that there were times where she felt like giving up, but she could not leave her kids behind. It is truly scary to know the things that go through a person's mind, especially when they are your everything. She had a death drive, but her motherly instincts never allowed her to act on those feelings. Knowing that most middle-aged adults feel this death drive, I can apply it to my future career in nursing 3 ways. I can have genuine conversations with my patients in every age range about their mental health, suggest help as an option, and provide them with resources as long as they are needed. In conclusion, most of those in middle adulthood have experienced this death drive, and their life instincts have overcome those feelings. Middle-aged adults only make up about 25% of the population. However, they make up more than 30% of suicides. Not everyone's life instincts can save them from that inward death drive. We need to be checking on our middle-aged adults and provide them resources so we can decrease that percentage. The next article I read dove into some archives from hospitals in England to gain a better understanding of how avoidable deaths are in hospitals. Using groups of people called reviewers, clinical professionals chose random samples from multiple hospitals to determine if there were any errors in the healthcare provided by professionals, leading to the demise of their patients. I learned the 2 terms for common mistakes made by healthcare professionals. Quote, we defined problems in care as patient harm resulting from acts of omission or inactions, such as failure to diagnose and treat according to evidence-based guidelines, and acts of commission or affirmative action, such as incorrect treatment or management, and harm as a result of unintended or unexpected complications of healthcare. My interest in hospital deaths stemmed from my lack of realization that death is real and my goal of becoming a nurse. No one close to me has passed away yet, thankfully, but I know it is inevitable. I also know that when someone passes, they leave loved ones behind, having to pick up the pieces so they can continue living without their loved one. My best friend of 10 years lost her boyfriend 2 years ago, and she had no closure and is still trying to navigate life without him. If I can not only help save lives, but avoid putting anyone in that kind of pain, I will be fulfilling my purpose. I want to provide the best care I can for those I come into contact with. My dream job is to be a registered nurse. I want to be an exceptional nurse. I want to make a difference any way I can for my patients, for them to feel like they are cared for and that I will be the one to jump through hoops to get them the correct care if need be. I want to make life better for each and every patient I encounter. While that may seem impossible, a little goes a long way and you just don't know what someone is going through. So even if it's just my attitude, I want to ensure that it's always positive. This article provides me with more information on how I can avoid both acts of omission and commission. In the medical field, I will never be afraid to ask for a second opinion if I am unsure of something. I will never jeopardize anyone's precious life intentionally. In fact, I will do everything in my power to do the exact opposite in my career. Thank you.
Hello everyone, my name is Simran. I'll be talking about late adulthood. Many people in the United States are living in nursing homes after losing their spouses. However, a little research has been conducted to investigate the level of suffering these people experience after losing their spouses. Understanding the helpful approaches that foster the healing and well-being are significant other diagnosis necessary for older adults. Their grief can sometimes have fatal consequences if untreated. Surviving spouses over the age of 50 has a 66% increased risk of dying within the first 3 months of the spouse's death. It connects to my career path as it offers psychological remedies to most challenges adults face after losing the better half. In connection to my career path as a therapist and counselor, I believe the article better places me to offer psychological help to grieving adults and other people after the death of their fellow adults. Thank you.
Thank you.
Thank you.
Thank you.